My interpretation of the results of the dapagliflozin trial are that dapagliflozin is definitely a drug for the treatment of heart failure. It's also a drug, of course, for treatment of diabetes because it lowers blood glucose, but it clearly does more than that. And even in heart failure patients without diabetes, there's a very substantial reduction in risk of adverse events, heart failure hospitalization, cardiovascular death. So clearly a new treatment for heart failure. So I'm sure most cardiologists are not familiar with using SGLT2 inhibitors, and we will have to educate them, but I have to say in this trial we used one dose once a day. It was extremely well tolerated. There was a very low treatment discontinuation rate. It doesn't cause renal dysfunction, it doesn't cause hypotension, it doesn't cause volume depletion, and actually doesn't even cause hypoglycemia. So all the things that maybe we might be worried about and have been familiar with for other types of heart failure treatment are not a problem with this drug. So it'll be very easy to use, and I don't think it'll be too hard to persuade my cardiology colleagues to use this treatment for heart failure.
Yes.
So dapagliflozin has an indication for the treatment of diabetes, and of course that indication would include patients who've got heart failure and diabetes. So in a heart failure patient with diabetes, I think that we can use dapagliflozin tomorrow on the basis of these trial results. For heart failure patients without diabetes, we should of course wait for regulatory review, for the guidelines committees to opine. I think it would be too early to advocate the use of dapagliflozin in heart failure patients without diabetes.